So social prescribing to me is all about connecting people who have social needs with what's happening in the community, because there's so much happening, and that's what I've discovered this year, is there's so much happening all around the county and all across the country. So as a GP trainee, I've had people come to see me and they've often got social problems, and I don't really know where to go with them, and I don't want to medicalise those problems. And in fact, there's research that suggests that about 20% of people who come to see the GP come with a primarily social problem. So that's anything from loneliness and isolation, it can be the kind of low-grade mental health problems, it can be debt, it can be employment. And to me, social prescribing is that link between, as a doctor, being able to give people the help they need, but not medicalising the help they need. So there's lots of things that they can do to get out and about into the wildlife of Cornwall. There's walking groups all around Cornwall. There's gardening groups. There's nature groups. There's farms that they can go to, and I don't know where they are. Well, I'm getting to know where they are, but lots of GPs don't know where they are, and patients don't know where they are. So it's linking them in. There's also art therapy groups. There's knit and natters, so people meeting up. Yeah, there's actually loads of different things, and there's even just things like gig clubs and different kind of sports clubs. But if you don't know about them, you don't know how to find out about them. It's linking people in with those sort of things. It's amazing actually when you start looking into it how much there is.
So we've been running a pilot over the last 12 months. We've had around 250 patients go into that, and to our surprise, when we looked at the data with those patients who've been going through the scheme, we found that they were using around 50% less appointments just through doing physical activity, getting together in groups. That wasn't what we designed it for, but it's certainly been a very welcome a spin-off of what we've been trying to do, and certainly of my colleagues and I, it's freed up some well-needed capacity. As I say, we've been doing a pilot for the last 12 months, and that has been more towards a sort of older demographic, but we are now starting to reach out to younger people, and so working with Pentreth and really trying to get into younger people's mental health problems. It would be well known as a documented tidal wave of mental health problems in younger people at the moment, and quite frankly the system can't cope with that. Anything that we can do to try and help with that, and I believe really strongly that these sorts of schemes do help younger people get more confident and break down the barriers of mental health problems. We're funding this ourselves at the moment. We had some seed funding from something called the Primary Care Home Project, which is a national new model of primary care run by the NAPC, but after that, the successful funding of that and some of the data and the way it was received by our patients, we're now funding that ourselves. Now we can fund it ourselves to a point, but if we really want it to reach its full potential and we want to scale this both within St Austell and beyond in Cornwall, then it will need some more funding. For me, this is all about face-to-face communication and working, and the key person here is the navigator, Hayley's role, and it's about her being in the practice, being visible to us, talking to us about our patients, and for a really easy conversation and a really easy referral pathway through to Hayley.
Well, right from the beginning, right when I came into post, the Eden Project were really looking at how they could help the community. So it just coincided with my with our project, St Austell Healthiest Project, starting, and I met Heidi from Eden really early in the game, and we were both passionate about doing something for the community. I mean, we do run support groups, so we do more of the social side of things, but we're also focusing on physical activity. But we would like to extend it because I've got a waiting list, and we want to see people sooner, because the sooner you see them, you know, you can strike while the iron's hot, and you can get them in while they're keen to make these lifestyle changes and have more time to support the patients.
I'm a type 2 diabetic, been diagnosed for about 10 years now, and when I was first diagnosed there was nothing like this. I had a diagnosis for tablets and told take lots of exercise, eat 5 portions of fruit and veg, and it's only recently that I've been able to get a prescription for more than just the tablets, and this is part of it, because I feel I was prescribed walking and taking exercise, but it was left up to me. And social prescribing has meant at last I can actually have a prescription for something that I can do. And that to me is very, very important. And we've got a walking group here at the Eden Project, and I've been with it now since November last year. I was asked if I'd lead a group, and they said, yeah, no problem. So now not only am I prescribed this, but I can't find excuses not to turn up on a Wednesday morning, because I have to turn up because I'm here for other people, and that is part of it.
So I'm Nick Cook, I'm a Children's Services Manager with Barnardo's covering the Southwest. So what Cafe Chaos do is they work on the level that the people that use the organisation are working at, which provides them not just with the support they need then, but provides them with the opportunities for them to develop further. And what is offered that's very different to other providers in Cornwall is kind of a focus on the individual, their holistic needs, and also the needs of tomorrow, which quite often are forgotten about. So what the whole place brings to the table really is that everyone can be an individual, but actually they can still be an active member of society, and those barriers can easily be removed and will enable people to be part of something that will just continue to grow.
It's a big leap of faith, I think, social prescribing, because actually I think the benefits come perhaps 1 year, 2 year, 3 years down the line. So you're almost having to stick your neck out and acknowledge you're not going to find immediate results in 6 months or a year. These results are going to run on, I'd say, 2, 3 years, 4, 5 years down the line. So in a way, to start with, you're having to accept that you're going to have to pay out to start with for the fact that you will make savings in other areas years down the line. And actually it's about making a kind of healthier society and communities, and building communities and getting people out and using their communities, which I think has been lost in this kind of modern era. And in a way the GPs kind of become the village priest, because people come to see us because they don't know where else to turn, because we're there, we're in every town, and they come and ask us for advice. And sometimes I feel we're not doing as good as we could do, as well as we could do to help these people. And it's connecting them with the communities they live in, because actually there's brilliant communities, but it's helping those communities to bring people out and improve their lives and improve their well-being. But that's not a quick fix. It's a slow process and it's an organic process, but I really hope that we can have that kind of vision to make that leap forward, to take that step, to demedicalise these things and really help people and their communities. So as a doctor, I think this is about changing the conversation, changing it from what's the matter with you and making that what matters to you.